So as we know that for us to achieve maximum impact of HIV prevention interventions, our response has to be targeted and precise. So in this case, we estimated coverage and gaps in utilization of HIV prevention methods. This was done among HIV negative individuals, those that were seeking care in HIV, in public health facilities as well as in social venues. So as you can do some quick math, it was around 3,000 something for the total. And then these were also, the age group that was targeted was 15 to 24, and then for male was about 15 to 30 plus. So, as we have heard from the talks, is that the gap now is on HIV prevention, but as we can see that as much as we can have funds that we need to invest in HIV prevention, there's a lot of gap that it is in utilization. So this was also done when we saw that overall 30% of the clinic and 60% of people that were found in social venues, as much as they reported high risk, but then they had access to HIV prevention methods, but then the utilization was really low across the study participants. And of interest, among women, the gap between access and use of condom was about 65.9%, and then 18.0% and 79.9% versus for the 6% in the social venues. But then also approximately 80 to 85% of the participants reported knowing where to get HIV testing, but then only few reported that they were tested within the last 6 months during the study period. So how do we now improve on the HIV prevention cascade? So also one of the things that I should also mention was that we defined HIV prevention cascade, not really as a tool for cascade, but then also as a framework that should be used to utilize, also to determine need, as well as access and also consistent use of the prevention methods. So gaps remain in the uptake of HIV prevention services among people that are also reachable at public health facilities and also in social venues. So there's need also to explore mostly the barriers. So in our sense, most in this case, I think the barriers are not really pertaining to access per se, but then they're mostly behavioral as well as social. Thank you, and I'll be happy to take questions. Thank you.
Great.